Hello and welcome to our broadcast. I'm your host, Syl Trepanier, Senior Vice President and System Chief Nursing Officer for Providence. As a reminder, the information provided during this event is for information purposes only. If you have any medical questions, please reach out to your primary care or health care professional. So joining me today for this live event is Stephanie Pigg and Emily West, two registered nurses from Lubbock, Texas. Stephanie, Emily, hi.
Hi.
Thanks for joining me today.
Thank you for having us.
Thank you.
You bet, you bet. Well, we only have 30 minutes together, so let's dive in to make sure that we take advantage of every single second. You know, maybe just to get us started, Emily, can you tell us a little bit about yourself and what you do?
Well, I am a nurse at Covenant Medical Center on South 10. That is our renal telemetry unit. We are a 30-bed unit that serves mostly renal patients, but we also have CHF, COVID, pneumonias, and we also do aquapheresis, which is really kind of fun.
Can you tell us a little bit about that?
Aquapheresis is a treatment for CHF patients. It's run by our nephrology doctors. So we hook up our patients through a central line to a machine, and it filters out the water out of their system without affecting their electrolytes.
Awesome. Thanks for sharing. You and I have to remember that sometimes we have people listening in that may not be familiar with our jargon. So I might catch us up from time to time. I'll be the first one to be guilty of it. So if I do, please stop me as well. So thanks, Emily, and thank you so much for joining us. Stephanie, tell us a little bit about yourself and what you do.
So I am currently at Covenant as well, main campus here in Lubbock. I was born and raised in Lubbock, kind of grew up around the area. I got my bachelor's of science from Texas Tech in 2015. And then I went on to get my master's of education from Wayland in 2017. And then most recently graduated from Covenant School of Nursing in April of 22. So I am kind of a brand new baby nurse, getting my feet wet. I've been a nurse for about 4 months now. I was a nurse tech before. I worked on oncology for a few months and then transferred over to SI4 from there, which is where I'm a nurse now.
Awesome. And you were just talking about you coming out of nursing school not that long ago. Can you share with us maybe your favorite nursing school memory?
I will say it was a little difficult since I started nursing school during the midst of COVID. We were online for about 3 to 4 of the 8 modules that Covenant has. So I guess I'd say, I wouldn't say necessarily favorite, but most memorable would be trying to learn how to insert a urinary catheter into a box. Instead, since we couldn't be in person, they sent us all home with a box, with a water bottle, and go from there. So
that was interesting.
Yeah, it was definitely a little different, but I guess if you can hit that, then on a human, it wasn't too bad once I got there. So, but we did clinicals online up until about module 3, which is where we switched to med-surg, and then we went to in-person clinicals, but then switched and weren't in person in class yet. So I wasn't really in person until probably about module 5, which was children, and it's very different from what I do now.
Yeah. That is interesting because people don't realize that. We all know, and everyone can speak to how much COVID has impacted their personal life, and it's impacted so many sectors of our of all different types of industries. And when you think about nursing students who now didn't have access to clinical settings the same way that we did. I suspect that you probably did a fair amount of simulation as well. Isn't that correct?
Yeah, and it really also helped since I was a nurse tech. I kind of still got some clinical experience outside because I was getting to be with the nurses in my professional side as
Uh-huh.
well as school. And you
Uh-huh.
do, you have simulation, which they have at the children's campus.
Uh-huh.
And we did have mannequins there, but you're realistically going 2 out of 5 days a week. So compared to what you're getting in the hospital, where every patient's a little bit different, every patient has a different aspect. Simulation was very like to the book. You could kind of figure it out without having to think too much, which is kind of, if that makes sense. It wasn't a bad thing, but it made you get a little too routine. And then once you got to patients, you're like, okay, not everybody is the same. Everybody's a little bit different. It's not all a textbook. So
I want to hear a little bit more about what made you, change career and go into nursing as a second career. But before we do that, while we're talking about, becoming a nurse, Emily, how about you? When did you decide to become a nurse? And maybe tell us something about any favorite nursing school memory, if they're not too far in the distance.
Well, I decided to be a nurse at 16. My youth minister at the time was a diabetic, and he went into kidney failure. So at 16, I was one of the few of the high school students that were taught what to watch for with him, how to manage his blood sugar if his sugar went too high or too low. I was one of the ones that was allowed to be at the hospital the day that he had his peritoneal catheter put in for his home dialysis, sitting with his wife. And right after that, his 3-year-old daughter was also diagnosed with diabetes. So I became one of her lead babysitters because his wife was a nurse. And I spent an entire summer taking care of her, learning how to check blood sugars, learning how to dose insulin, learning how to draw up insulin. And, Dave died when I was 17 and a senior in high school. And before he died, I said, I'm going to do this for you. I'm going to go into healthcare and take care of patients in honor of you. And 9 days after I started at Covenant, Jessica, his 21-year-old daughter, the one that was diagnosed with diabetes at 3, also passed away. Oh. So now I do this every day for them, in honor of them. And, it's fun when I get to share their stories of what amazing mission-minded people that they were. And for me, this is my mission, and I carry it on for them. And a nursing school memory, well, I was a 9/11 nurse. So I was actually in a clinical at 9/11. I was working at Good Shepherd Medical Center in Longview. I will never forget it. And I was working in the intermediate care unit, and my patient was a heart cath patient and had been on heparin for overnight. And he wanted me to pull his sheath. And I was like, whoa, I'm a nursing student. I am not allowed to do that. That is well beyond my scope of practice. But they got all kinds of special permission that day. They had my nursing instructor come up. They had the cardiovascular surgeon come up. They had the cardiologist come up. I also worked at that hospital as a nurse tech. They had my manager come up, and I started an IV on him right as the plane hit the tower. And then the next thing they said was, okay, you are going to pull this sheath. And we sat there watching the planes, and while I was holding pressure after I had pulled the sheath. And I don't know that that's a favorite memory, but that is definitely something I will never forget.
Yeah, no kidding. It's very interesting. I appreciate you sharing. Yeah, all of us do remember where we were on that 9/11. I also just want to go back uh, to uh, to your story on how you became a nurse and what inspires you to become a nurse. First, thanks for sharing it. Clearly, super, personal, story. And how powerful is it to know that, uh, you're saying you're doing that for them, and look at how much they've done for you,
Yeah.
uh, right?
Yes.
And that's, and they're carrying, even today,
Mhm.
carrying you, as you carry them in your heart. They carry you through your day in and day out in your profession, and
Mhm.
that's beautiful.
Yeah, it's an amazing family. I still visit with the two younger sisters and their mom periodically, and we stay caught up on Facebook and watching their journeys as the girls have graduated from college and started their careers and stuff now. So it's been fun to watch them grow.
Awesome, awesome. So something that you and I carry together is how you were drawn into our profession by people who were close to you, in this case your pastor, and that was newly diagnosed diabetic, and the impact that that has on someone's life, particularly a few years back. I mean, even today, but we do have some technology today that that helps us care for those patients a little bit easier than it was way back when. uh, I, uh, I went into nursing because my father was diagnosed as a diabetic at a fairly, he was a late type 1 diabetic. I was 7 or 8 years old, and now I'm going to age myself, but Joe's were during the years where we actually didn't have uh, machines to check the blood sugar, but he had to urinate in this little tube, and then we had to put a pill in it. Then we had to check the color, and then the color would actually tell us whether his, what was the level of his sugar in his system, if you will. So I get, I think it's interesting that you and I were drawn into it to care for people we loved so much, for the same type of disease.
Mm.
I want to go back to Stephanie. Stephanie, you, nursing is your second career, right?
Correct.
And so tell us more about that. Why nursing is a second career? What made you choose that?
So I was a teacher and coach for 3 years, roughly. Before, while I was getting my master's of education, I was actually working for Covenant Health, one of the clinics, with Dr. Sabuni and Dr. Henley. While working there, I was about 2 months from graduating with my master's, and I knew I wanted to stay in medicine. But at that point, I pretty much had already spent so much money on my master's that I might as well give coaching and teaching a try. So I did that for a couple years. And then I was like, okay, I still have this really big draw to medicine, really big draw to caring for people. And kind of similar, my dad had shattered his collarbone. And when that happened, my brain just kind of kicked in and went in, I guess you could say, nurse mode without me being a nurse at that time. And he always kind of said that he just saw me in that role. So after teaching for a few years, once COVID hit, that December, I guess right before COVID, I decided to apply to nursing school. And I was like, if I get in, it's where God wants me to be. It's what I'm supposed to do. And I got in, and then I always just had, as cheesy as it may sound, always had a calling towards medicine and a calling towards helping and realizing like people are at their lowest and hardest parts of their lives and just being there for them and kind of being that sounding board and being that soft touch and that soft mind of just, I'm by your side. I might not be able to answer all your questions. I might not be able to help you with everything, but I'm by your side at all costs, you know? And to me, the being attached and being around patients for 12 plus hours was a really big deal. And being able to teach them, you know, like I said, I was a teacher for 3 years. So teaching was something that I cared about, but I also wanted to challenge myself. So this was a way that I could still teach patients, teach families, but challenge myself every day and challenge myself to learn new things. And it's something different every day. You know, I'm coming into my workday with no idea, unless I just happen to have the same patient. And even at that, you may have the same patient, but they may have a neuro change, or, you know, end up going to surgery and then coming back with something completely different. And just that aspect of getting to learn about it and getting to engulf and bring people into the fun part of learning and getting to know their body. And like I said, knowing everybody's different and learning that to me, the brain is extremely interesting, and working for neurology let me see that. And then now being in SICU, since we're on East 4, we get a lot of neurology, and that is a huge passion for me. So getting to see and getting to work with those doctors is just, you know, like I said, it just makes my heart skip a little beat. It's just a true passion that I've realized. It took me a little bit to get there, but it's, now that I'm here, it's definitely where I've belonged. But.
Well, we are very lucky to have you in our profession, and thanks for making the switch. You know, and I wonder, I don't know if it's a fair question or not. So it's okay if you want to think about it, and we could come back to it later. But you know, you just transition into practice, and my sense is there's probably something about the profession that surprised you in one way or another. Maybe is there something that you're seeing that's part of the profession that you expected it, and it's that and then some, and you'd want to talk about it, or something about the profession that surprised you? You weren't expecting that. Not that it's bad or negative. It's just not what you were expecting. That's already coming as a realization for you, since it's fairly new.
I will say, for me, my unit is really big on teamwork, which is part of why I selected it when I was trying to get hired. And for me, that was a huge aspect of nursing that I absolutely love. You know, they tell you you're never alone, and it's been shown that way. And you can always go and ask questions, and I absolutely love that. As for something unexpected, I guess for me, it was a little bit different because, you know, I've worked with doctors in the past, but now being on a floor that we have intensivists on the floor at all times, that relationship and having doctors that look at you like you're equal is absolutely amazing to me. And it never crossed my mind that they would consider me just as smart as they are. And, you know, they're doctors, obviously. They know a lot more than I do, but feeling like they're truly listening to me and feeling like my input is taken in account is just amazing. And it was extremely unexpected to get to see, you know, from a unit secretary aspect when I was working in the clinic, of getting to work with them, you know, but you're really just setting up lunch, setting up patients, to now the patient day-to-day care and getting to discuss with them, okay, I think we should, you know, kind of lean this way, or their urine output is low. What do you think of that? And just, you know, having that real camaraderie and teamwork is just amazing to me. And it is extremely important to me, especially coming from the coaching world.
Yeah. I can appreciate that. And, you know, good for you and your teammates to fully leverage the importance of working as a team, because that's the best way we can meet the needs of our patients. it's not so much that one knows more than the other. It's the fact, I think, that we know different stuff,
Mhm.
and we approach patients differently, and patients have different needs, and certainly all the learnings that you've had through your education and life allows you to meet their needs, and to care for them both,
Mhm.
physically, emotionally, spiritually, and the likes. And it takes a village.
Yeah, it really does.
It takes a village to do that. Absolutely. Um, Emily, you and I have uh, finished nursing school a little bit longer. We've been nurses longer than Stephanie has, and I can't remember exactly how long it's been for you. If you think back about how you were formed as a nurse, and you think about nursing education today, anything comes to mind that's changed? That you're seeing as you're seeing new nurses coming in on board, like Stephanie. What's changed from your perspective, if anything?
Technology has changed a lot.
Mhm.
I've been a nurse for 20 years, and it was paper charting and maybe one computer, maybe two computers on the unit. If that, the secretary would have a computer, but most of the time the nurses wouldn't, and it was all paper charting. So,
Mhm.
um, and I guess the other thing that I find entertaining when I'm working with the students is they don't do care plans or concept mapping the way that we did. I can remember sitting in my parents' living room floor trying to get this care map all set up and drawn. And, it wasn't on a sheet of paper, it was on 2 or 3 poster boards that I would then glue together. And for them, it's all done on the computer. And they have apps for everything, apps for studying for the NCLEX, apps to look up skills if they don't remember 100% how to do something. There's an app for that, and it's interesting to see the difference from me going to look up in a book, because that's still what I'm more comfortable with, to
Yeah.
there's an app for that.
Yeah, yeah. No, I mean, definitely. I mean, you're spot on, right? Technology has certainly added a different. It's certainly changed, how we practice, how we prepare ourselves. That's for sure. If anything, access to resources, like you just mentioned. Good news is there's an app for that. You got that right. They'll be able to figure it out. So you've been a nurse for 20 years. Every time I chat with nurses, I find out that there's a moment in our career as a nurse that sticks with us. What's that moment for you?
There's been quite a few, but the one most recent that I truly can't get out of my head was a patient that I had during COVID, on Christmas Eve. And, I spent hours in the room with him, and his family couldn't be there. They were out of town. So I put on my pepper, and I just stayed in there with him. And for his daughter, her main thing was wanting to see his hands. I just want to see my dad's hands again. Can I see my dad's hands? So, we didn't have an iPad on the unit that we could use for FaceTime. So I just pulled out my phone, and I would FaceTime her for 15 or 20 minutes every couple of hours or so, and let him see his hands, and see his face. And I would hold his hand for her, But the thing that I just kept saying over and over and over is, I'm not going to let him die on Christmas Eve. She's not going to lose her daddy on Christmas Eve. I couldn't imagine losing a parent on Christmas Eve, and to help keep his oxygen on, that's what I had to do. He figured out right quickly that he could pop off his oxygen with his jaw, and he would do it. And if I was in there with him and holding his hand, he wouldn't. So that's just what I did, and I will never forget him. Unfortunately, he passed away on Christmas Day, which was devastating when I came back to work and found that out. But I just didn't want them to have that memory tied to losing this dad and this grandfather on Christmas Eve.
Yeah, it's this is a reminder that we see so much joy, and we have the opportunity to assist so many, and some of the assistance at times is to help people transition, and that's what you did for both him and his family. I certainly I can understand and respect why this is sticking with you, and it's likely going to stick for a long time. Thanks for sharing. I really appreciate that. Stephanie, I want to ask you this question because you've transitioned so not long ago in becoming a nurse. Anyone out there considering becoming a nurse, going back to school, what advice would you have to offer them?
I'd have to say probably try to be adaptable. It's a whole different world. Everybody before nursing school says nursing school's hard. It's something you've never experienced. And that's definitely true, especially after going through it in COVID and being older. It was a little bit more of a transition. Luckily, I had quite a bit of experience with technology before that, so that did help me. But being adaptable is it's the key. It's already a stressful situation. And if you just stress yourself out and overthink and, require yourself to make the dean's list every module and things like that, you're just putting extra pressure on yourself, And it's one of those of, if you're taking care of what you need to know on the daily basis and patient-centered care at all times, then the 85 on a test isn't that big of a deal versus a 90. If you're taking care of your patient in the end, and your patient is your key, and knowing what's going on with them, then it's all worth it. School, it's rough, especially being older. Luckily, hopefully nobody ever has to go through it during a pandemic again. Hopefully that doesn't have to come back. But it's being adaptable definitely just helped me not overstress, especially being an overthinker anyways. If I was sitting there requiring myself to make the dean's list, I probably wouldn't have survived, because mentally I just wouldn't have been capable. But being willing to adjust and being willing to learn new things really opens up that door to being a successful nurse, and is going to make me into the nurse I am today and the nurse I am in 20 years, because I'm willing to learn and adapt to the different, technology's changing, virtual nursing's becoming a thing. All of that aspect is kind of starting to implement into the bedside world as well.
Yeah.
So even now out of school, we still have to adapt.
Yeah. Yeah. Great advice. Great advice. Thank you so much. Can you believe 30 minutes have just poof, just coming on just like that. Thank you so much, Stephanie and Emily, for joining us today. And to everyone for listening and sending in your questions to learn more about our initiatives, our programs, our services, ways to give, or if you are looking for help or medical advice, please visit providence.org. And make sure to follow us on social media at Providence on Twitter and at Providence Health System on LinkedIn, Facebook, and Instagram. Stephanie, Emily, thank you so much.
Thank
Thank
you.
you.